Morning. Today's topic is Introduction to Orthodontics. Contents, definition, branches of orthodontics, needs for orthodontic treatment, aims, objectives and goals of orthodontics, and history of orthodontics. Coming to definition of orthodontics, orthodontics is that branch of dentistry concerned with the study of growth of craniofacial complex, development of occlusion, and treatment of dentofacial anomalies. Next, we are coming to branches of orthodontics. There are basically 4 branches of orthodontics, that is preventive orthodontics, interceptive orthodontics, corrective orthodontics, surgical orthodontics. Now we will deal with one of the following branches, that is preventive orthodontics. Preventive orthodontics is mainly to prevent the malocclusion before the occurrence of the malocclusion. According to Graeber, it is the action taken to preserve the integrity of what appears to be the normal occlusion at a specific time. To preserve the normal occlusion, to do whatever necessary to preserve what is normal, that is known as preventive orthodontics. Next is interceptive orthodontics. It is that phase in orthodontics in which it is the science and arts of orthodontics employed to recognize and eliminate potential irregularities and malpositions in the developing dentofacial complex. Means if the malocclusion has already occurred, then we have to take necessary steps to prevent that malocclusion. That is known as interceptive orthodontics. Means to intercept the process of malocclusion at the specific period of time, that is known as interceptive malocclusion or interceptive orthodontics. Next branch is corrective orthodontics. Corrective orthodontics means to recognize the existence of malocclusion and need for employing certain technical procedures to eliminate the problem and attain the sequelae. Means if the patient has reported with the already a malocclusion, then you have to recognize what is that malocclusion, then we have to take the necessary steps to correct the malocclusion by various appliances. Next is surgical orthodontics. Next branch is surgical orthodontics. It includes the surgical procedures that are carried out before, during or after active orthodontic treatment. These surgical procedures is usually done after the growth period. For class 2, class 3 malocclusion, for intrusion during the gummy smile or vertical maxillary excess and all, you have to do the surgical procedures. That comes under the branch surgical orthodontics. Now, need for orthodontic treatment. Why we need orthodontic treatment? First reason is psychological well-being. Malocclusion adversely affects the appearance of a person, leads to psychological disturbances. Thus, treatment of malocclusion in such patients help in improving the mental well-being and confidence. It will increase the confidence of the patient, so they can smile properly. So it is done for psychological well-being. Next reason is poor appearance. Means why patients come for orthodontic treatment? For poor appearance or for aesthetic enhancement. The poor appearance due to malocclusion affects the child performance in school as well as in the play. So, treatment should be initiated. Preventive or interceptive measures should be attempted to correct the poor appearance or to enhance the aesthetical appearance of the patient. Next, a goal is interference with growth and development. Abnormal perioral muscular activity causes morphological and functional changes to dentition. So, to correct that, we have to do the orthodontic treatment. Speech defect. The, the connection between the various speech defects and malocclusion is of some practical importance. For example, if a patient cannot attain contact between the incisors or the patient is having open bite, it will contribute to production of lisping. So, to correct all that, we have to correct that malocclusion or correct that open bite or midline diastema spacing and all to correct the speech defect. Mouth breathing. In many cases, reduction of increased overjet activates the upper lip, making the lip closure possible to establish anterior oral seal and stimulates nasal breathing. Sometimes what happens when the tooth is proclined, the patients will be unable to close the lip. So they will be having incompetent lip. So to correct, by correcting the proclination, they will achieve a lip seal. So the mouth breathing habit will be reduced. Caries prevention. Malaligned tooth makes oral hygiene maintenance improper or difficult, so thereby increasing the caries risk. The orthodontic reduces the risk by correction of malocclusion. Periodontal disease prevention. Crowding leads to one or more teeth being squeezed buccally or lingually out of their investing bone, resulting in reduction of periodontal support. When there is crowding or when the crowding is there, the tooth will be out of the arch, so it will lead to the periodontal disease. The periodontal support will be weak for that tooth. Traumatic overbite also lead to increased loss of periodontal support. Traumatic anterior occlusion displacing the lower right central incisor labelli, and this is associated with dehiscence. See in the picture, the lower anterior tooth has been displaced labelli because of the crossbite, so it will lead to dehiscence. The same patient, but the crossbite has been corrected, so with a removal applies and there has been improvement in the gingival condition. When that crossbite is corrected, the gingival condition is improved automatically. So traumatic bite leads to periodontal improper periodontal or decreased periodontal support, so it should be corrected. Prevent trauma to anterior teeth. The risk of trauma to upper incisors increases with the size of overjet. So, the teeth that are severely proclined are at a high risk of injury, especially during play or by accidental fall. So, the proclination by orthodontic treatment, you can correct the proclination and you can prevent the trauma to the anterior tooth. Prevention of risk of root resorption. In the cases of unerupted tooth, there is risk of the resorption of root of adjacent teeth. So, by correcting that impacted tooth or by pulling the impacted tooth or correcting the impacted tooth, the periodontal condition of the tooth can also be improved. Prevention and management of temporomandibular joint dysfunction syndrome. Malocclusion associated with prematurities and deep bite are believed to be a cause of TMJ problems, such as pain and dysfunction. Also in the cases with bruxism. Next is goals of orthodontics. What are goals of orthodontics? According to Jackson, he has given Jackson's triad. That is, the goals of orthodontics consist of three things, that is functional efficiency, structural balance and aesthetic harmony. Functional efficiency, it depends upon correct relationship of the teeth to each other and their orientation to skull as a whole to permit a satisfactory functioning of orofacial apparatus. Structural balance. A balance between soft and hard tissue should be achieved. Failure to achieve structural balance will lead to relapse or loss of correction. Achieving skeletal balance maintains stability of correction. Aesthetic harmony. The single most common reason for the patients to approach the orthodontics is to improve the facial appearance or enhance the aesthetics. So, improvement of facial aesthetic is the prime objective of orthodontic treatment. Not only the aesthetic but also along with aesthetic enhancement, the structural balance and functional stability should be maintained. Scope of orthodontics: alteration in tooth position, alteration of skeletal pattern, and alteration of soft tissue pattern. These are all the comes under the scopes of orthodontics. Coming to history of orthodontics, most dominant dynamic and influential figure in orthodontics was Edward Hartley Angle. He was responsible for organizing and systematizing orthodontics. He is known as father of modern orthodontics. In 1900, Angle started his first school of orthodontics. Publication of Book of Orthodontics in the year 1887. He introduced the hypothesis key of occlusion. He introduced line of occlusion. He published the classification of malocclusion. Appliances developed are Angle's E-arch, pin and tube appliance, ribbon arch appliance, edgewise appliance. The term orthodontics was coined by James Murray. Norman Kingsley is known as father of orthodontics. E.H. Angle is known as father of modern orthodontics. Remember, Kingsley is known as father of orthodontics and Edward Hartley Angle is known as father of modern orthodontics, and first appliance was banded by Perry Fauchard. The term of malocclusion was coined by Guilford. Thank you.